Dr. Jaffe, what products would help someone dealing with ALS, and would the LRA be helpful in this condition?
Well, ALS is amyotrophic lateral sclerosis. It's also known as Lou Gehrig's disease because the famous baseball player Lou Gehrig died of it. If it's a true case of ALS, I would recommend supportive care, and the supportive care would include the 4 self-assessments and the 8 predictive biomarkers, especially the LRA tests and plan. However, be aware that ALS has been resistant to successful outcome treatment for decades. And to the best of my knowledge, the best of the researchers today who spend their entire lives, within the ALS world, will tell you that they can slow the progression of what appears to be an early acquired oxidative damage to the DNA, extensive enough that the repair histone proteins no longer repair the DNA. And it takes decades for this to begin to express itself as a neurodegeneration. And if you look very carefully, what happens is there should be an end plate of the nerve that is physically snuggling against each muscle, telling that muscle when to relax and when to contract. In ALS, that separates. And eventually, the muscle atrophies because it's not getting input stimulation signal. If it was a very early case of ALS, I would do everything I talked about in order to improve quality of life, and I would go by results. And I have heard anecdotally that people who follow the alkaline way and did all the eat, drink, think, do things that we would put together have done better. But I don't have, and I don't know that any of my colleagues have, a prospective series of, say, 20, 30, 40, 50 cases of ALS, and there is more of it than there used to be, although it's not very common. Now, if it was moderately to significantly advanced, then I would say this is palliative care, but it still improves quality of life. So wherever you are on the ALS spectrum, I would be supportive using our approach, recognizing that it is not specifically to address the ALS, but to improve the host resilience and hospitality.